what is our approach from a functional medicine perspective? Because typically from a traditional medicine perspective, you do a colonoscopy, you go in, you cut the thing out and you go, okay, I'll see you later. Come back in 2 years. I'll do another one. Hopefully you don't get another polyp. And we call that, active surveillance. And to me, I think it's inactive. It's doing nothing and waiting and hoping
Sure.
instead of going, gee, why did I get the polyp in the first place? And how do I prevent that from happening? And that is the difference between functional medicine and traditional care. We're always thinking about the why, not just the what, not just do you have a colon polyp, but why do you have it? And how do we understand the biology underneath it? How do we test for what's going on that's causing it? Like, would your doctor, who's a gastroenterologist, look at your butyrate levels? No, they're not going to do that stool test. At the UltraWellness Center, we do those tests, and we do see these factors in much more refined relief and can actually figure out what to do in a personalized way to help people really improve their overall health and get this better. So let's talk about how do we make the body completely inhospitable to cancer and particularly colon cancer and colon polyps in general.
Yeah. How do we create a terrain where cancer is less likely to grow? And the first thing I always focus on is lowering inflammation. You want to lower inflammation locally within the intestine and lower inflammation systemically within somebody's body. And so you can measure inflammation by looking at things like C-reactive protein, by looking at somebody's waist to hip ratio, because that abdominal fat creates inflammation. You can measure if there's inflammatory markers in the stool. And you can get a sense of somebody's level of inflammation by their diet that they have, because some diets are more pro-inflammatory. And that's one of the first places we work to shift, is shifting a patient's diet to one that's more anti-inflammatory, more rich in phytonutrients, rich in plant foods, rich in fiber, rich in omega-3 fats, and lower in sugars and refined carbohydrates. And so inflammation is one of the things I really look at testing wise, and when you're looking at somebody's situation. We also work to lower insulin levels. We work to lower toxin levels in their body. We pay attention to their microbiome and what kind of are we seeing inflammatory bugs in their gut? Are we seeing the bugs that are associated with lower levels of inflammation in their digestive system? So we evaluate their microbiome. And of course, we pay attention to those lifestyle factors that really impact somebody's risk of developing cancer.
Yeah, and there's those things we mentioned really key: getting insulin down, getting your toxic load down, improving the health of the microbiome, dealing with the
Yep.
things that drive inflammation. Right? We talked about how to build up certain good bacteria by providing the different kinds of fibers. There's soluble, insoluble fibers. There's prebiotic fibers. There's probiotics. You can take butyrate. There's all the phytochemicals in food we're talking about that help. All the spices we can include in it. I love making spicy foods. I make tons of things. I use all kinds of spices. And I think that is a great way to increase the phytonutrient content and reduce inflammation. You mentioned green tea and pomegranate, curcumin. The broccoli family is fascinating. The broccoli family is one where, they've actually literally measured broccoli in the urine, what the byproducts of broccoli in the urine in large populations, in China, and found that those who have the highest levels of these chemicals from broccoli in their urine have the lowest levels of cancer. And that's because it helps us to activate the genes that suppress cancer. It activates our detoxification system. It helps reduce inflammation, and it's powerful. Flax seeds are also great, as you mentioned, and they have lots of benefits in terms of doing things, fermented foods, probiotics. All these things are things that we can include in our general well-being and lifestyle program that help to reduce our overall risk.